I welcome you to this very small talk about our paper, which is titled Direct Oral Anticoagulants for the Prevention and Acute Treatment of Cancer-Associated Thrombosis. The main point about our review is that it is a literature review. Now, as we all know, cancer is a major risk factor for both venous thromboembolism and cancer-associated thromboembolism. However, our paper focused mostly on cancer-associated thromboembolism. Low molecular weight heparin used to be the actual standard treatment of cancer-associated thromboembolism, but this was before DOACs, so direct oral anticoagulants, came into place. So our aim for this review was to review the current evidence there is on the use of direct oral anticoagulants, which talk about the prevention and the acute treatment of the first few months of cancer-associated thrombosis. We discussed the main trials which we could find. There are SELECT-D, Focus-I VTE cancer, ADAM-VTE, Caravaggio, Canvas, and Castaviva, which talk about the prevention of cancer-associated thrombosis in general, while Evert and Cassini talk about cancer-associated thrombosis prevention, which has to do with mobile patients, especially mobile patients who have already started chemotherapy. We have also went through the recommendations of recent guidelines about DOACs, and we discussed the guidelines which one can see on the slide. Overall, our main findings and conclusion included that apixaban, edoxaban, and rivaroxaban were all assessed in randomized controlled trial of acute treatment of cancer-associated thrombosis. In general, they showed better efficacy than low molecular weight heparin. Apixaban and rivaroxaban were mostly assessed in the prevention of cancer-associated thrombosis, which has to do with mobile patients who have already started chemotherapy. The DOACs in general were included in recent guidelines for the treatment of cancer-associated thrombosis in selected cancer patients, and they were suggested for primary thromboprophylaxis in selected ambulatory cancer patients who have a high risk of VTE. Since DOACs have a high increased risk of bleeding, they should always be given with caution in patients who are at high risk of bleeding. So, for example, they have gastrointestinal or GU cancer. And this is why the recent guidelines suggest that they should be given only in selected cancer patients. I hope you found this interesting, and I encourage you to read our paper. Thank you.